Welcome, I'm Dr. Michael Hoerger, and I'm here to give you my 2024 update on surviving the COVID-19 pandemic, things I've learned so far. Chapter 1, the pandemic rages on. If you already know me, it's probably from my work running the top publicly available U.S. COVID forecasting dashboard, pmc19.com/data. PMC stands for Pandemic Mitigation Collaborative. We've heard many public health leaders make statements like COVID is over, but those of us tracking transmission know that's a myth. In fact, COVID is raging right now. So how do we know? Let's talk about my pandemic forecasting dashboard. This uses wastewater data to estimate current transmission levels and uses annual and recent trends to forecast into the future. Basically, if you're actively infectious with COVID, you'll poop a lot of virus. The more virus in wastewater, the more transmission, and this maps on extremely closely to estimates of true case rates, a correlation of 0.94, in fact, a near perfect association. Using analytic models, we can forecast into the future. I cannot emphasize enough how basic such forecasts are. It's the same way businesses forecast how many employees to work a shift, how much inventory to keep on hand, or sales volume a particular day of the year. These forecasts are highly accurate, explaining 96% of the variability in transmission a week out using historical data, a little less accurate in real time, but still very strong, even when we're talking about predictions 4 to 8 weeks out. So we still see a lot of reliability. What does it show? We're in the second highest COVID surge of the pandemic, the highest surge in 2 years, in fact. So it's most clearly not over. About 1 in 3 people in the US will get infected during the 2 months of highest transmission of this surge, and about 43% of Americans will be infected if we count the entire tails of the wave. There's actually more transmission occurring today than during 96% of all of the days of the pandemic, so it's very much an ongoing issue. Since I'm here to tell you more about the pandemic, I'll share a bit about my background. My research team has been conducting pandemic-related research from the very start of the pandemic. We've studied factors that predict COVID hospitalizations and mortality, helped understand pandemic-related needs in the service industry, and examined how the pandemic affects people's mental health. We've informed CDC guidance to make vaccines and treatments more accessible based on known risk factors, ran the first study to distribute N95 masks to the community during the onset of the original BA1 Omicron wave, and are distributing PPE to people with cancer currently. On a more personal level, I've got 3 young kids, older family, and work closely with people who have very serious cancer diagnoses, lots of high-risk people. So I've paid attention and spent a lot of time researching pandemic-related issues. I'm a transdisciplinary scientist with expertise in psychology, oncology, health services research, public health, and analytics. I read the table of contents of many of the top medical journals the day they come out so I can stay up to date on issues related to COVID as well as oncology care. And sometimes I can even see those studies earlier thanks to preprints and helpful people sharing on social media. So you can find people with greater niche expertise, but my unique perspective is bringing it all together.